Welcome back to Empathy is Money. My name is Namdi. If you're tuning in for the first time, we talk about healthcare entrepreneurship, technology advancements in healthcare, and all that you need to learn to be successful if you're to get into the entrepreneurship space in healthcare. And on this episode, I'm going to take you through 10 examples of innovators in the healthcare management space. Let's dive right in. Healthcare entrepreneurs continue to revolutionize the way healthcare is delivered to patients, and they're improving patient outcomes. So, and these ideas that I've chosen today, they're not like you don't have to do them, but they're stellar examples, or what I consider ideal examples of what entrepreneurs should be doing if they're considering healthcare. Some historic treatments that when we look at back at them with modern eyes, they look crazy, but they were groundbreaking at the time. Modern entrepreneurs in healthcare currently continue this history of innovation. That's how we achieve groundbreaking and results and good patient outcomes. They've revolutionized the way doctors treat patients. They've designed digital services and medical distribution models that they would have seemed miraculous hundreds of years ago, and changed the way healthcare is delivered to patients and patient populations. As the healthcare industry continues to grow and improve and expand within the US and globally, a lot of opportunities create new and better ways of doing things, and we must, as entrepreneurs, grow along with it. So let's first ask the question and understand, what is healthcare entrepreneurship? Healthcare entrepreneurship is the act of creating a product or a process or a service that fills a need, a gap that you've identified as the entrepreneur through market research or data or patient interviews. You've identified this gap and you are providing this service, and in exchange you get paid dollars, or you get paid for it. Healthcare innovators can come from a clinical background or science or a business background, or may even have a combination of those terms of experiences and education. Doctors and nurses are often naturally drawn to innovation and entrepreneurship, given that it's part of the clinical practice, and they see firsthand the need for a new way for something to be done. A lot of the processes that have been in place over the years have become outdated and are causing tremendous inefficiencies and waste. Healthcare entrepreneurs solve these problems. Areas of healthcare entrepreneurship fall into the following broad categories: medical treatments, techniques, devices, and drugs. Take, for instance, antibiotics or artificial hearts, or drug categories that include statins, laparoscopic surgery. These treatments have changed completely modern medicine, so completely that people now take them for granted. But when they came in the scene, they were revolutionary. Healthcare entrepreneurs who develop new medical devices or drugs, they follow the innovative tradition that have existed over the years. And some of the recent examples are antibiotic envelopes. Antibiotic envelopes essentially are devices that are used to deliver antibiotics around an implant site, such as a cardiac implant. I'm not going to go deep into it. Just giving you an idea of some of the innovations that are currently in use in the medical space that are being taken for granted. Something else is anti-tremor devices, such as gloves or cuffs, that disrupt signals in the brain to reduce tremors due to Parkinson's disease. Other innovations include heart monitoring devices or cardiac monitors, rescue inhalers, stents and valves, surgical tracers, even blood components and cells, growth factors. These are some of the biologics that aid in speeding up the healing process. Some innovations in the administrative space, uh, from single physician practices to large hospital systems, they operate across several borders, several states across the country, and they need tools to manage a vast array of tasks. Healthcare technological entrepreneurs, they need to be equipped with cutting edge strategic planning skills that address administrative needs of healthcare providers and administrative tasks that are required in every healthcare organization. And some of these tasks that they happen day to day and they help administrative facility, hospital or patient care facilities run efficiently are scheduling, Medicare coding, patient health records, finance billing, accounting and invoicing, medical staff certification and licensing. These innovations continue to make healthcare patient experiences top notch. Some consumer devices like smartwatches and similar track people's health data, and they include vital signs, your pulse, heart rate, what diet that you're on, exercises or exercise regimen. These devices, I have one that, like the Aura Ring. That's some of these devices. They are ready for innovation, and as an entrepreneur, you can come in and improve on existing devices or create a whole new product. Entrepreneurs have already developed a number of applications that consumers use to monitor this data and track their own metrics. But we need innovation in distribution or sharing the data with physicians. You still have problems with data being siloed with at different hospitals and different institutions, but we need more connectivity. I would argue that the patient needs to move around with their data so that you don't have this disconnect when a patient goes to different facilities and they have to the healthcare professional has to contact the previous health facility to get data. One promise of these devices is that the data that they collect can be used to identify disease clusters, or as in the case of the recent pandemic with COVID-19, it can identify outbreaks before they even happen. So while experts say that these consumer devices raise data privacy concerns, I don't think they do. But even if they did, there's an obvious gap there that entrepreneurs can step in and develop mobile apps that meet the growing demand. Another space is the wearable health technology. Similar to smartwatches, wearable health technology is an area with great potential for new applications. Some of the stuff that we've seen already are cardiac and glucose monitors that patients wear around, and they're even getting better. Some of those monitors used to be clunky, but now they're getting better as technology improves. Glucose monitors prescribed for health conditions. Healthcare entrepreneurs are actively creating innovative technologies to revolutionize healthcare delivery solutions that take advantage of the growing interest in these devices. A lot of our patients are getting older, they're staying active, and they need to take their healthcare monitors with them. There needs to be a dashboard that provides real-time health data that gives the patient more control, and you can see your numbers in real time, and it's also reported it in real time to your healthcare provider or physician. Some innovative healthcare solutions that exist are biosensors, blood pressure monitors, glucose monitors, heart monitors, including rings or connected rings like Aura Ring, like I mentioned earlier, and smart wear, smart apparel. Let's talk about technology, the data, and artificial intelligence. If you know, you may have heard innovation in technology is exploding across healthcare when it comes to artificial intelligence. Examples in the space of machine learning, big data, blockchain, electronic health records, and electronic medical records. These technological applications have transformed all aspects of healthcare delivery, and they promise to improve care quality and patient safety as well as advance research. A lot of doctors were slow to adopt telemedicine for many reasons, and some of the reasons that they cited were compensation concerns, their ability to diagnose patients through physical touch, among other things that they were complaining about. But then the pandemic happened, and the people were, the flaws in the system were apparent. There are still barriers to telehealth, but the positive aspect of telemedicine needs to be highlighted. And one of the biggest positive or the benefits of telehealth is lower cost of care. Patients with mobility issues rely heavily on telemedicine for their healthcare and the convenience of telemedicine. And this is starting to bring more physicians and healthcare professionals into the space. All right, so what are the obstacles to innovation in healthcare? People who are considering healthcare entrepreneurship, they face huge barriers to drive innovation. A lot of them are around legal concerns, regulatory concerns, and these calls for a need for capital investments in research and manufacturing. There's also a need for capital investments in medical or science and compensation structures.